So welcome back to part 2 of our lengthy skincare podcast. We're in this part, we're going to be talking about social media trends and Ozempic phase. Let's go. Let's go back to that red light or that mask, because I think it's kind of it sort of jumps into our next thing, which is like trends on social media. These masks are trending, right? What do you think? I mean, do you think they have some utility? Are they backed by some science? Do you recommend them? Do you use them? Should everybody use them? Is there an
There's
age limit?
That's an interesting question. I'm not sure about the age piece, but there is a lot of supporting literature to say that red light therapy is very good for your skin. And yes, I do have one, and,
Good.
and I really like it. And I can say anecdotally that it does work well. So I think adding that to my regime has helped me. Yeah. And that's the key, right? It's not just one thing. There are multiple things that can support your skin health, and that's how we need to look at it to actively participate in that journey of skin health and building skin health. That's, it's not one thing. But some of the masks have the blue light as well. So red light is not necessarily helpful for acne, but if you have the blue light component, then that can be something that someone, if they were struggling with, they should look into. Yeah.
hmm I think with them, that consistency is key also. You
Mm-hmm.
do have to use them 3 times a week, I would say, in order to see good results. Shahima, how often do you use yours?
I've been cheating. I've been cheating. I would say I use it 5 days a week. Yeah.
Wow, okay.
Yeah, and I double dose, so I rather than 10
Good.
minutes, I go for the 20 minutes. It's
We have
helping.
the time. Why not?
So it works, and generally, like people, we're in this era where everyone wants immediate gratification, right? And so what I want our listeners to be able to get is like, how long would you have to use this red light, for instance, to be able to notice a benefit? I'm assuming that it's not going to be like you put it on at one time for 10 minutes and you take it off and you're like, look at my face, it looks great,
No.
right?
Yeah. Yeah.
So what are your thoughts? Like generally, I know everyone's going to be a little bit different, but generally, what do you expect? What are you telling people? Like a week, a month,
Well, I would say closer to a month.
Yeah.
of
Yeah,
at least
because it
three
does
times a
take,
week?
yeah, it does take time for collagen to build as well. You're looking at like 6 weeks potentially.
Yeah.
I'm sure you would see some benefit on yourself at probably 4 weeks, and then having others compliment you on your skin is probably closer to 6 or 8 weeks, maybe.
Yeah. I agree. Yeah.
And I think I think what I've heard here is a few things. One of which is like generally consistency is important. Whether that's
Yeah.
your red light, whether that's your products, you got to do things consistently. And red light maybe 3 times a week, but products probably every day. Certainly sunscreen should be every day. I'm like a mental note of that for myself. Um, so that's one of them, consistency, right?
I think, sorry, I didn't mean to
Yeah.
cut you off. I think for when I'm working with clients and creating a plan, it can be overwhelming, right? I honestly work with the client in terms of what is doable for them. Creating a plan, picking things that would be doable for them, and then them able to get used to some sort of a plan for themselves and the utility of that plan, and then being able to add in is great because right now, when I open up social media, it's overwhelming. There is so many things coming at you, and it's a little disjointed, right? Try this, try that, try that. For a client, it's very overwhelming. And at some point, you're thinking, I can't do an 8-step regime for my skin. Like, who has that time? Okay, let's pick what are the things that would be most doable for you. And if we get from that perspective, as a health promotion perspective, I think more people would be able to manage their health, skin health, well being much better
Agreed.
than just throwing things at people.
Totally agree. Okay, Jenna, anything to add?
No, I agree with that. You never want to do something, go overboard, and then people get confused. They're not using it properly. Maybe
Hmm.
you're causing more harm than good at that point. So, yeah, I think it's really person dependent and great. If they come in and they want a full routine, perfect. We can set them up with that. But if they can only do two things, we can work with that too.
Pick the
Yeah,
two most impactful things.
Yeah.
exactly.
Yeah. And I think that segues to the next topic that I really want to discuss, which is like the trends in social media. So, I mean, social media really is a double-edged sword, right? I mean, it helps to get promote things that are good. Like if there was a social media on on sunscreen, great.
Hmm.
Um, but then also, like you said, it can be very confusing to a lot of the people, right? Because there's so many of these trends out there, and then they come and they tell you they want something, but that's not really what they should be getting, right? And so
Exactly.
let's talk about
Yeah.
some of these trends. Like let's talk about microneedling, like microneedling versus RF microneedling. Who should get that? Who should get what? What's the difference? How do you choose? Maybe Jenna, you could start.
Yeah. Yeah, RF microneedling was quite a craze there for a while, and everyone seemed to be getting microneedling treatments, even the people who didn't need it. So I typically say if you're younger, just stick with the basics, stick with regular microneedling.
What's
If
younger?
you
What's
like 20s, 30s,
okay? Younger
yeah.
means
And
okay.
then once you're looking at like wanting to firm the skin, tighten the skin, then you can look at things like radio frequency microneedling.
Okay, and so I'm going to assume here, based on what you just said, that one is stronger than the other.
Yeah, so with regular microneedling, you don't have any energy with it. So there's no radio frequency or heat that you're delivering into the skin. Whereas with the RF needling, you are delivering heat. So you are stimulating the fibroblasts a little bit more. You're going deeper into the skin. But sometimes you don't need that on someone younger.
So, what are some indications then that people should be like? What are some reasons that people should be thinking in their minds about getting microneedling rather than an influencer telling them they should?
In like microneedling in general.
Or microneedling and RF microneedling? Like,
Yeah, totally.
when
I
should
would
someone
say
start thinking like, maybe this is something that I should be getting?
definitely, yeah. If your concerns are mostly textural or collagen based. So if you're noticing that your skin is getting a little bit thinner or crepey, if you've got large pores,
Sorry, did you
fine
say
line,
creepy?
Creepy.
crepey, yeah, like the fine little crepey. It's usually like
Oh,
under
creepy. I thought you said
chin.
creepy. Okay.
Creepy can be creepy.
I was like creepy, like in Halloween, like mask. Okay, so you said, okay,
No, give
creepy.
it a look.
Okay, okay,
Look
okay,
like a Halloween mask once your
okay,
treatment's finished. Yeah.
okay.
um, what was the question
So
again?
sorry, texture. You said
Texture, yes.
texture,
Texture, fine
crepey.
lines. Yeah, if you're more scarring, stretch marks, those ones are all great.
Did you say fine
But if
lines?
yes, yeah,
Hmm.
fine lines, wrinkles, especially static lines. So if you're getting Botox treatments and you're reducing those dynamic lines with the Botox, and then you still have static lines when you're at rest, you need to buff those out with microneedling.
That's so interesting. I never even knew that myself. Okay, so this is great information. So I mean, people tend to think of like if I got some wrinkles, I must go neuromodulator or Botox, right? I mean, I
Hmm.
know we say Botox, but it's a brand name. But neuromodulators, that's what they think. But you're saying that
Yeah.
microneedling has a role. And in actual fact, microneedling and neuromodulators or Botox can go hand in hand.
Well, I mean, if you think about it, the skin, once it starts to create these fine lines, it's going to get deeper, right? And the root cause is that your collagen and elastin production in that area is somehow inhibited or reduced in its function. So the neuromodulator, like a Botox or Dysport, is actually just going to the muscle, right? And pretty much paralyzing the muscle or partially to not create that muscle movement, to exaggerate that movement, exaggerate that fine line. But the root of the matter is the collagen and elastin. So once we have someone using microneedling, the induction of the collagen and elastin increases, right? So now we are, somewhat thickening the skin, strengthening the skin matrix. And by doing so, that person is going to have a longer term effect of a better skin presence, right? And perhaps their need for a neuromodulator will be less. Uh,
Interesting.
and that's what we really want, is for people to have long-term good effects, not just band-aid. I mean, neuromodulator is a beautiful. I call it pixie dust. It works really, really well. But for my clients, I want them to have really good skin and optimize on their skin matrix as best as they can as well.
So combining both. Good
Yeah.
one.
Yeah.
Good
I
one.
always say that treatments are better when they're in combination.
Yes. Yeah.
Yeah.
Always.
Yeah. And then you add on top of that, I suspect, some skin products, and then now it's just like adding. It's just you're just getting so much
Exactly.
better, right?
Mm-hmm.
Yeah. Okay. Very interesting. I certainly didn't know that. How about another trend? Like I hear this all the time. What are your thoughts on PRP?
Mm. I do like PRP, but it has to be a high concentration of platelets. So not all PRP is good PRP.
Mm-hmm.
You have to have the right equipment. You have to be seeing a skilled professional. But I think you can get some really great results, especially under the eyes, where a lot of times fillers don't look as natural in that area.
And so, what do you mean, like under the eyes, or like what are you using PRP for? Because I mean, PRP is just kind of this big giant term that people throw around, and you get PRP in your joints, you get PRP in your, in your tendons, you get PRP in your hair or your hair follicles, right? And so, what are you referring to PRP specifically, Jenna?
Yeah, so PRP is going to, it contains growth factors. So you're going to brighten that skin. You're going to get it thicker. It's going to look just more smooth and vibrant. So we actually inject it right underneath the eyes. And that can stimulate more collagen and elastin in those areas.
Okay, so specifically under around the eyes, that's where you
Yeah,
predominantly use
you
PRPs.
can also add it in other areas. I just find that I'm using it mostly under the eyes because I don't love fillers under the eyes.
Okay, do you have any
Yeah.
thoughts, Shima?
So PRP, it really has stood out for regenerative medicine, right, and health. It's well established in terms of the literature. And Jenna, you brought up a really good point, is the concentration, right? So there has been well-established concentrations where for gynecological kind of treatments, the concentration has to be very high. Whereas, and then the next concentration that needs to be high is hair. And then skin doesn't require as high of a concentration. So different machines yield different results. And at the same time, we have to consider the client's health, right? So if they are struggling with thrombocytopenia, for example, low platelet counts, those that can impact how effective the PRP will be. You're going to get poor platelet plasma
Yeah, good point.
versus platelet-rich plasma. So PRP can be used for many things, including joints. I think I want to try that in my joints with some stem. But I really love the idea of regenerative medicine. I've tried it for my hair. It worked really, really well. And like Jenna said, under the eyes, it's a really good option. But we have to remember that it's a commitment of maybe at least 3 treatments before someone would be, I would say, satisfied
Okay.
with the results. 3 is minimal. It could be 3 to 6.
Okay.
So there's a commitment there.
I'm going to move us along here because we can clearly talk forever.
I like to talk.
So
Sorry.
one of the other topics that I really want to touch on is Ozempic face. So trending, or it was trending in 2024, certainly still a problem now. You guys want to just briefly talk about it? How do you recognize it? And more importantly, is there a way to prevent it or not? Yeah, prevent it essentially.
Mm-hmm.
So maybe we'll go Jenna first, and then we'll go to Chima.
Sure. Yeah, I am seeing that a lot more in my patients now. They're seeing this rapid change in their skin and they don't know why. And then it all comes back to Ozempic. Um, I think you can touch on this a little bit, but I think it maybe depends on the dosing as well and how quickly they're increasing their dosing. But ways that we can kind of slow down that process would be things like Sculptra, um, potentially Radiesse, fillers, even microneedling. So I just think staying on top of that and doing those while you're on Ozempic can definitely decrease your chances of ending up with this Ozempic face.
I agree. I think the key is not just finding a provider that is going to monitor you well. I think is key. I think you had a podcast around weight loss, sorry, and the speed of weight loss can really impact the health of your skin. Now, if there's fat loss within the skin, your estrogen levels and reserves are impacted. Well, that impacts greatly the way your skin will look. And that's why we see people who've had quick weight loss look gaunt, look ill almost. Their radiance is gone, their color is off. Their hydration, like the what we call our hydration reservoir within the fat area of the face, is also compromised. So there's so many different things that are happening, and I would say to people who are thinking about that to really seek out a provider who can manage the dosing properly. Can also, it's great to put a synthetic drug into your body for weight loss, but we also want to encourage the body naturally to start producing some of that GLP-1, right? It's complicating, but at the end of the day, how do we treat it in aesthetics is what I like to see is clients who are on this weight loss program to be on a good assessment plan so that we can mitigate factors that make the person look not well when the whole plan was to look good, right?
Yeah. I mean, for me, I could touch on it from a medical standpoint. My focus always in whatever I do is prevention is always better than reaction. And so, making sure people don't get Ozempic face is way easier than me trying to help them once they've already got it.
I know.
Right?
Yeah.
And I think that that's what what I sort of rely on you guys for as well, is to help with that, right? And so for me, it's not just it isn't always it isn't necessarily dose dependent, although you could argue that it is dose dependent because the higher the Ozempic dose, the more people lose weight generally. And yes, the rapidity or the how quickly people lose weight does impact that. But Ozempic also causes it can cause fat loss in different areas of the body kind of differently.
Mm-hmm.
And that's where you lose a lot of this volume in the face. And so that's why I thought, a good skincare product that helps to encourage like the scaffolding in the skin to be maintained through collagen and potentially maybe some microneedling to help again encourage collagen production and tightening, right? Before you get to the point of having to try to need fillers to fill the gaps left. You know what I mean? Because
Mm-hmm.
oftentimes that's a sign of like this weight loss and this fat loss that now the skin hasn't been able to, um, I guess, shrink along or fast enough along with the loss,
Yeah, you make a really good point. Yeah.
right? And
Yeah.
so, and I touched on this in our menopause talk, which is um, it's way easier to treat people when you prevent something
Mm-hmm.
than to treat
Yeah.
the aftermath.
That's true. Yeah.
Right? And so that's something that I think we obviously recognize, and I think we need to, as you had mentioned, Shahima, really have a good plan for, right? And follow. Um, okay. I'm gonna, we're close to the end of our podcast here, and so believe it or not, so I'm gonna ask some questions that were posed to us from our online audience who registered, and so this question was the first one, and I'm gonna actually add a second part to it because it's a question I know that I had for a long time, which is, does Botox ever start to lose its efficacy or its effectiveness? Right, in another word. And the second question is there an age that's too young to be using Botox? I know a lot of people sort of feel like Botox, once you're on it forever, and you become dependent on it.
Hmm. That's really good. I wanted to address the part around losing efficacy. And that may speak to people who may develop resistance. Okay. The two key things around that I talk about with my clients is having the right dose for that muscle. So everyone's different. So the muscle will determine how much it needs. Secondly, is the literature has, and they've done lots of research on it, and they don't recommend injecting before 3 months. Okay, so people who are getting results lasting for 8 weeks and then thinking that they need to get another treatment is at risk for developing resistance, right? So that's really important. Sometimes a client will say to me, well, I don't want that much. And I will say, we could try try to do a lower dose, but in 2 weeks, I need to see you. And if that muscle isn't treated properly, you're not going to get the duration that you need. And you may develop over time with that repetition of treatment that resistance.
Mm.
So that's key.
Okay. And so, Jenna, anything to add? And also, is there an age that's too young?
I agree with that. Definitely. There also have been studies showing that the possibility of zinc orally before and
Yeah.
after your treatment can also increase the longevity of your treatments. So that's very new, but that's something that's coming out. So worth a shot. And as far as is
Age and
someone too
dependency,
young? Yeah. Um, I mean, I wouldn't treat someone who doesn't have those static lines. If they're not there when the patient is at rest, they probably don't need it. Yeah. So once those start settling in your 20s that can be, then you can start doing Botox, but Other than that, I just don't think it's quite necessary yet.
Okay, and what about this dependency worry or fear that people have?
If you stop doing Botox, your face will just go back to how it was before. It's not like it's going to suddenly get worse because you did Botox before and then you stopped. So that's a myth that a lot of people think it will get worse, but it won't.
Yeah.
Yeah.
And I think that's what everyone worries about, right? I when I talk to people about Botox and neuromodulators in general, it's about prevention. You want to prevent those fine lines because, again, to not to beat a dead horse here, but that's my practice is always better, or always focuses on prevention, right? And so if you can prevent those fine lines, is way better than trying to deal with the static lines that you get, right? Okay, next question. This person is a male. Essentially, to summarize, he would love to try Botox, but he's just worried that people at work will be able to recognize that he got it. And so this is about, like, how or is it possible to maintain a natural look? I mean, I know the answer to this, but is it possible to have a natural look? And do you have is there any skincare maintenance on top of, say, neuromodulator or on its own that can help that?
I think for males, often there's some definitely beautification that happens to maintain that masculine look, right? And males are treated differently. I treat males differently than females. According to, of course, their needs. To get that natural look, males often don't want all the lines gone. They don't want that frozen face. They want to move their eyebrows around. They want to be able to frown. And that's really based on getting the right assessment and having a provider that is listening to you. And you can certainly achieve that while looking good and looking refreshed, but not looking frozen. That is not a good look for many male patients. As well, there's characteristics that is unique to males, right? Males don't like an arched eyebrow. They like the bossing around their eyebrows to be a bit more formed. These are attractive masculine qualities, and I think we can do it.
Anything to add there, Jenna?
I agree. I think starting with maybe one area first, starting with something that's not as noticeable, maybe in between the brow area, and then kind of working your way up. You don't have to do your whole face in your first session.
Yes, and I think you guys are saying that there is definitely a way to make it look natural.
Yes.
Okay. Just quickly here, I know we're running out of time. Biggest myths about aging that you wish people understood, and how can we change the conversation? Just quickly, Jenna and Shahima. Any myths about aging that you wish people understood?
Well, I have to say, for aging, for myself, I feel better now than I did when I was younger. And that is directly related to how I care for myself, right? What I feed my body, how I take care of my skin, how I take care of my mental health. These are all aspects, these are investments, these are long term investments. And I feel, we don't have to be extreme. We don't have to look at aging as being either are you an anti-ager, right? I don't really buy into that. I don't want to anti-age. I love being 55. I love that I've had so much time on this planet to enjoy the experiences and learn. And I want to take care of myself. So I have many more years to go.
Good.
Mhm.
Jenna?
I think to add to that is that you can still look like you while doing these treatments and just trying to slow down the clock. You don't have to look unnatural. You don't have to look not like yourself. That's not what we're trying to do. We're just trying to pause the clock and turn you back a few years.
Yeah, I think that's so important. We're not looking to recreate you.
No, we
We're
want to keep your unique features
yeah.
and just enhance what you once had.
I think plastic
Exactly.
surgery, if you really wanted to change your face, that's not what we do. I think that's great. That's a great reminder. Next question. We're almost at the end. Do lip fillers dissolve, or is there a component that stays under the skin?
Well, literature has shown us that MRIs, that people have done MRIs, and residual filler or hyaluronic acid remains under the skin or within the tissue that it was injected, and it can move outside the tissue that it was injected. It may not be in the same form as when it was injected, so it's kind of degraded a bit, right? Broken up a little
But
bit,
still there.
but still there. Yeah.
I don't necessarily think that that's a bad thing either, because hyaluronic acid is going to hydrate the tissue. It's going to hydrate your skin. People were really freaked out by that MRI, and it was quite the hot topic. But I think it depends on what type of filler you're using, what plane you're placing it in, what injector you're going to, how much volume they're using. So there's a lot of factors that play into that.
Hmm.
Okay, and I guess quickly the a follow up question to that would be like, what's lip filler made of, and is it a synthetic or is it natural, and should we be worried about this stuff staying in our bodies?
Well, hyaluronic acid, sorry, Jenna,
No, no, you're good.
hyaluronic acid is a sugar molecule that is naturally produced by our body. So we have it. We often are facing a decline of that production. And which causes people to feel like they need some sort of volumization. And hyaluronic acid is often used for volumization. Um, so, what we are putting into people is a synthetic form of the sugar molecule hyaluronic acid. And I mean, in terms of looking at longitudinal studies on is it harmful, I'm not sure that it's been around forever, but I really haven't seen anything that would say, it's a carcinogenic or something like that. So, but, time and more studies may reveal something different.
Okay,
Mhm.
and last question here. What technologies and treatments are coming our way in 2025-26? I assume this is probably related to skin. And thoughts on AI consultations for patients.
Mhm. Something that I think is coming is exosomes and stem cells. I think that in the next few years, we'll be able to inject them. I think that that will be really groundbreaking in aesthetics. AI consultations. I I think it's better to see a provider and build a relationship and build that trust with them. I think that AI would take away that personability component.
And also, I think, like we said, our face and our skin is changing, it's dynamic. And that might not be necessarily picked up by AI. Whereas when you have that relationship with your provider and they're putting their eyes on you, they can see changes that maybe you don't even notice. Right? I see things that my client will be like, I didn't notice that. And I'll be like, yeah, when did that start? I don't know. So artificial intelligence, I don't know. I mean, the capacity for AI is endless, I think. But at this moment in time, mm, I would stick to human eyes on me.
Yeah,
Yeah.
yeah. So we are overdue, and so I have really enjoyed this. It's clear that we could have spoke for another hour probably and answered more questions and discussed more things. I've really enjoyed this. I mean, I thought it's been very informative for me, and hopefully the people who are watching this will also find it informative. Any last thoughts? I think from the two of you.
Gosh, I really enjoyed it too. Thank you, both of you.
Yeah.
It was really engaging. And I think hopefully it's useful information to our
Yeah.
listeners, and they're able to find what they're looking for, in skin health and their wellness,
So
because there's lots out there for you. Yeah.
yeah. So I mean, I think there's so many topics, and you know, maybe with this podcast, the people who are watching it may have more questions that they could reach out to us, and maybe we can have another podcast on to answer more of those questions. Because again, I think there's so much misinformation out there. It's really hard to make heads or tails out of it sometimes. And I'd like to believe that we're a reputable source. So I've really enjoyed this, you two.
Thank you.
Thank you.